there's one thing that is interesting in imaging is that you have regional information, which is, something we'll never get from fluid biomarkers, considering every other perk they already have. So my work is currently very focused on understanding the subtypes or different patterns in amyloid-PET and also tau-PET, actually, but specifically amyloid-PET I'm particularly interested in, and to see what clinical utility it has, or if we could further stratify people based on the extent of pathology or the location of pathology. Because, amyloid-PET is currently within trials, it's still the inclusion criteria, need to be positive on PETs. It's the outcome measure, how much centiloid do we see, so the quantitative measure, do we see change after the drug? And it's related to a few other downstream biomarkers. So it's still a very core element in the current trial. But you can also appreciate from the inclusion criteria that everyone of 30 centiloid, which is a sort of a quantitative scale, roughly between 0 and 100, with 0 being completely normal, 100 being in the dementia population, everyone of 30 and above is included. And you can imagine that not everyone is in the same disease stage, or what kind of effect that has on how long you need to get a drug, for example, how quickly it's removed from the brain. There's some first analysis done on this. So hopefully taking the extent into account could streamline a bit further the individualized treatment plans. And then the regional information, what is my interest is that I had a publication in neurology I think 1 year ago now. Yeah, we're already almost 2024, so a year and a half ago. Where I found actually 3 patterns of the amyloid accumulation rather than the one that is generally described, which was related to different genetic risks, different demographics, and different etiological diagnosis. And I'm currently working on optimizing that model and make it generalizable so we could apply to other data sets and validate basically the findings, and also investigate if we do see different patterns of that pathology-based amyloid-PET with other pathologies. Think of the tau-PET subtypes, but also think of vascular burden. Do we see different interactions there, and subsequently different disease trajectories, so a decline in cognition? So that's currently the focus of my work, really disentangling the different subtypes that we see based on imaging, and see if we can use that information to improve our clinical workup, but also our trial designs.